Now we have to discuss about the topic therapeutic incompatibilities. That is, first one is the physical incompatibility, second one chemical incompatibility, third one is the therapeutic incompatibility. First of all, the definition of therapeutic incompatibility. That is, the therapeutic incompatibility may be occurred as a result of prescribing any certain drugs to any patient with the intention, that is with the desire to produce a specific degree of pharmacological action, but the nature or the intensity of the action produced in the patient is different from that which is intended by the prescriber. Okay, the prescriber prescribed to produce a specific degree or range of pharmacological action, but the pharmacological effect or action which is produced in the patient is different from that intended by the prescriber. Okay, then these therapeutic incompatibilities occur in the patients due to the following reasons. That is, first one is error in the dosage, and second one is wrong dose or dosage form, and contraindicated drugs or synergistic and antagonistic drugs or drug interactions. Okay, by these 5 reasons mainly the therapeutic incompatibility occurs. Then first one is the error in dosage. There are many therapeutic incompatibilities which are result from the errors in writing or interpreting the prescription. Okay, various therapeutic incompatibilities are occurred due to errors which are occurred during the writing or interpreting or while reading the prescription. The most serious type of dosage error while dispensing the prescription is the overdose of a medication. Overdose is a very severe or very serious dosage error. So the pharmacist have to check the prescription before dispensing it for whether there is any overdose cases. Okay, then if there is any such cases, if there is any overdose problem or any other incompatibilities, the prescription should be referred back to the prescriber. Okay, for example, atropine sulfate 0.006 gram, phenobarbital 0.015 gram, aspirin 0.3 gram. We want to prepare 10 capsules. Here the problem is that the quantity of atropine sulfate is more than its minimum recommended dose. That is, the atropine sulfate is overdose. Okay, so the prescription should be referred back to the prescriber. The next example is that codeine phosphate 0.5 gram. We want to prepare 10 powder. It is also an example for overdosage. Here the physician may be intended or may be desired to prescribe 5 milligram of the codeine phosphate, but he is prescribed 500 milligram of the codeine phosphate in this prescription. So we want to refer back to the prescriber. Then next one is wrong dose or dosage form. There are certain drugs which have quite similar names, and in such cases, if there is the drugs having similarity in their names, there occur confusion or there will be occur the problem during the dispensing. Okay, there are high chance of dispensing the wrong drugs. For example, prednisone and prednisolone. Here there is the similarity in the name, that is prednisone and prednisolone. So there will be a chance of dispensing the wrong one, digoxin and digitoxin. Here also there is a similarity in their names. So the pharmacist should be careful about such names of the drugs. And also sometimes many drugs which are available in different dosage forms. So dosage form should be clearly indicated in the prescription. If the dosage form is not clearly indicated in the prescription, the prescriber, the pharmacist should be refer back to the prescriber for mentioning the clear dosage form. Then next one is contraindicated drugs. There are certain drugs which may be contraindicated in a particular disease or a particular patient who is allergic to it. For example, corticosteroids are contraindicated in patients having active peptic ulcer. If the patients have active peptic ulcer, the corticosteroid drugs are contraindicated. Okay, then penicillin and sulfa drugs are contraindicated to the patients who are allergic to it. For example, sulfadiazine 250 mg, sulfamerazine 250 mg, ammonium chloride 500 mg. Here the problem is that ammonium chloride is an urinary acidifier. Okay. So this ammonium chloride causes the deposition of sulfonamide in the form of crystals in the kidney. So combination of ammonium chloride and sulfonamide is sulfonamide in crystal form in the kidney. So these prescriptions should be referred back to the prescriber. Then next one is synergistic and antagonistic drugs. There are many drugs which exhibit synergism or antagonism when they are administered together. So what is synergism? Synergism means if two drugs are taken together, they tend to increase the activity of each other. This is called synergism, and antagonism is just opposite to this. That is, if two drugs are prescribed together, they have the tendency to decrease the activity of each other. Then synergism is usually intentional by the prescriber, because the prescriber has prescribed the drugs together to increase the activity of the drugs. For example, combination of aspirin and paracetamol increases the analgesic activity, and combination of penicillin and streptomycin increases the antibacterial activity of antibiotics. That is, if we are taken the aspirin and paracetamol together, it will increases the analgesic activity. Then we know penicillin and streptomycin are two antibiotics. So if we are taken penicillin and streptomycin together, it will increases the antibacterial activity. Okay. Then there are certain drugs which when prescribed may lead to disastrous consequences. Such prescription should be referred back to the prescriber. For example, amphetamine sulfate 20 mg, ephedrine sulfate 100 mg, syrup QS 100 ml. We want to make a mixture. Here the problem is that here we are dispensing combination of two sympathomimetic drugs. So there will be an additive effect. Additive effect means they will increase the activity of each other. So we want to reduce the dose of the each drug. So this prescription should be referred back to the prescriber. Then if the drugs administered together having opposing pharmacological action, then the antagonism occurs. Okay, for example, acetyl salicylic acid 0.6 gram and probenecid 0.5 gram. Here acetyl salicylic acid and probenecid are used in the treatment of gout, but combination of acetyl salicylic acid and probenecid neutralize the action of one another. Okay, so there will be no action, there will be no effect or pharmacological action against the gout. So refer back to the prescriber. Then last one is drug interaction. The effect of drug is altered by the prior or simultaneous administration of any another drug. The drug interactions can usually be corrected by the proper adjustment of dosage if the suspected interaction is detected. For example, acetophenetidine 150 mg, acetyl salicylic acid 200 mg, caffeine 30 mg. Acetophenetidine and acetyl salicylic acids are analgesic drugs. Acetophenetidine depresses the CNS. The acetophenetidine have the action which depresses the CNS. This side effect is undesirable. This side effect in case of an analgesic, it is an undesirable side effect. So here we are prescribing or we are adding caffeine in the formulation. Caffeine is a CNS stimulant. So this caffeine neutralizes the side effect of the acetophenetidine. Okay, acetophenetidine is a CNS depressant and caffeine is the CNS stimulant. So there will be a neutralization of the effect. This in this case, in this prescription, this incompatibility is intentional by the prescriber, so we can dispense the prescription as such. Then another example is that tetracycline hydrochloride 250 mg, we want to prepare 10 capsules, and then the direction is given that take one capsule every 6 hours with milk. Okay, here the problem is that the milk which contain the calcium, so this tetracycline is getting inactivated by the calcium. So if we are taken the tetracycline with milk, the action of the tetracycline get inactivated. So tetracycline should not be taken with the milk. So in this case, the therapeutic incompatibility is unintentional by the prescriber. Unintentional means unknowingly prescribed by the prescriber. So the prescription should be referred back to the physician. These are about the therapeutic incompatibility.